Hey ladies, so it's Mickey. So I wanted to do a vlog about Sophia's appointment today with the ear, nose, and throat doctor, the ENT. Sophia has what's called a preauricular ear pit. So if you don't know what that is basically a little hole right here on her ear. I will try to keep her still long enough to show it to you. Might have to just stick a picture in here of it. But yeah, some babies, while they're in the womb, during the week that their ears are being formed, may not close up the holes by their ears or something. So some babies are born with two. Sophia was just born with one right next to her left ear. This can also be an underlining issue. Basically, sometimes babies with that or people with that might have kidney issues, of course, ear infection issues, because it is basically a tract, I don't know, one of those. Basically, like a tunnel or something down to the sinus. So a lot of times babies might have issues with ear infections or drainage. Sophia does have a little bit of drainage that does come out just every once in a while, and it's not pus, it's not colored or anything, it's clear, that comes out of hers. Or sometimes it might get blocked with skin cells and create an abscess. So it is something that if your child has it, you do have to watch out for consistently. Make sure that it's not red. Make sure that it's not, this area right here is not swelling up, stuff like that. If it does become a problem, like a consistent problem, ENTs do end up performing surgery to remove it. Now it's not just like a small little thing that's just right here on the surface. It actually goes down into like closer down in your ear. So they make a small incision and then they take that out. I'll try to post a picture that I found online of it in here somewhere. And they remove that, then close that little tunnel up, and then close it up on the outside as well. That's just a, like he said, a 45-minute surgery. But of course, Sophia's just 5 months or getting close to 6 months. So she's way too young to even think about doing surgery on, especially right now, since we don't know if it's going to be a consistent issue. She has not had any ear infection, thank goodness. Just the minor drainage on it. So it's just something right now we're just going to watch. If she does develop ear infections, we will go ahead and, get antibiotics and stuff just for the meantime. The ENT did mention that we would consider surgery starting at 2 or 3 years old. Now, by that time, we will not be living here in Virginia, so that would be up to whoever we get next as an ENT, if wherever we are living at the time. So, yeah. Another issue that does happen with, not always, but just like is something we have to watch out for, with babies with this, it's a congenital malformation or deformation, don't know which one it is, but it is congenital because it happens in the womb. Is hearing loss. Sorry, my brain is not here. Hearing loss is a big thing that you want to make sure that has not happened, or is not happening because of this issue that they have. So she did pass her newborn hearing test, and today she did have an audiology test. So we went into a room, a soundproof room. They had like a little machine that it sort of looked like the ear temperature thing. And then it ran a test, and then she put it in the other ear, it ran another test. So she passed that, and then she did another test that looked like a small little, you know, the little iPod ear plug thingies or whatever they're called. I don't use them, so I don't know what they're called. But they had like the teeny tiny. They were like tiny plugs that they put in her ear, and it ran another test, and then she did it on the other ear and it ran another test. So she did altogether 2 tests, you know, 4 different times, and Sofia passed all of them. So hearing loss right now at this time is not an issue with her, which is great. So yeah, if you have any questions about this, there is a lot of information out there. One thing that I looked up is, when you look it up, you see a lot of forums, which is okay, but at the same time, you do want to look at medical websites and medical research, which a lot of times is very, very wordy. You might get lost in it, but for me, it makes me feel better when I'm reading it from a doctor's perspective on, you know, what to expect or what could be an issue, or, you know, things that you are going to rule out when you go to an appointment for this. So yeah, that's pretty much it. If you have any questions, feel free to ask. I will try to follow up as much as I can on this. Right now, it's not an issue with her. She is doing great. She will be going back to the doctor in 6 months, so she will be a year old at the time. Wow. So she has an appointment in the end of January. And I will keep y'all updated. She is smiling away right now. I will keep you updated on everything that's going on. So I am going to try to show you what I'm talking about without her looking. Oh, no, she sees herself. She's a big ham and loves to look at herself in the phone. But that little hole right there, that's what all this fuss is about. You can barely see it, especially when she's rocking. But right there. So yeah, that is what a preauricular ear pit is, and that's what it looks like. Like I said, on her, it's just that one little thing. When she was first born, I used to say that she was born with the little reset button, like you know, Buzz Lightyear. When they pressed it, he, you know, started speaking Spanish and doing the tango. So unfortunately, that's not going to happen with Sofia. So, not yet. Right, Ruby? So, yeah, just not yet. Not quite there. But that's it. I will talk to you later. Bye.